but the patient has to initiate it. That now has turned into, euthanasia. We're going to just push, and like my mom's on Medicare. I'm like, hey mom, we had a good run. It's been good. Sorry, Washington has changed me, mom. I got Potomac fever. It's like, it's ridiculous. My aunts, my great uncles, my grandparents, I watched both of them pass away before my very eyes and watched them on Medicare be able to have health care. It's just ridiculous to think that we would want to do something like that. And so these people have consistently said that it's strangling my small business. One guy we had at a round table about a month ago, he closed down his lawn and garden shop, 15 people, because he couldn't afford health care, just shut the business down. Said, I'm not going to have a business where I can't give health care to my employees. And a lot of Delphi retirees who have taken a buyout, were promised health care and a pension, and now they're 60 years old and don't have health care. Machine shops, I can go through a list. Amweld Steel Door, Youngstown Steel Door, right down the list. We see it, we read it in the paper every single day. These are the people who need help. And the news was there at the fundraiser last night. I said, people ask why we need health care reform now. I said, there's 300 reasons.
What about you, Congressman Boccieri? You got a lot of lobbyists lining up to see freshman congressmen from the 60s.
Ralph regulars.
We've had. Where's Congressman? Where's Ralph?
Yeah, we've had some conversations with them, obviously about how this is going to affect our district and whatnot. But I think the president has said it best when he said, "Fear is not a tool of leadership. Fear is a tool of the status quo." And what we've seen in the debate right now is that you inject an effective political tactic, is inject all this doubt, inject all this conjecture that drags down the discussion to a point where we're not even talking about the real issues, we're not talking about the bill, we're not talking about the substance of the argument. And I have grown increasingly frustrated that we're having to defend these types of discussions, what the Congressman Ryan was talking about, rather than talking about the substance of the bill. The fact that we're proposing a new idea for America, and let's have a debate on the new idea and the proposal, rather than talking about death panels and just unbelievable. And for someone who hasn't been in politics all that long, I think this has been an awakening for how these types of movements begin. And look, they are real people. They're real Americans. They're real Ohioans who are expressing their frustration. Perhaps it's a much larger issue. They're focusing on government as a whole, and they have the problems with that. But it's transcended this debate into something that I think has been very harmful for the issue as a whole.
Congressman Boccieri and Congressman Ryan, let's we're going to pause for a moment. Jan Roller's going to offer some mid-program announcements, and then we'll begin the traditional questions from the audience. Jan.
Thank you. Today at the City Club of Cleveland, we are listening to Congressman John Boccieri of Ohio's 16th District and Congressman Tim Ryan of Ohio's 17th District, and moderated by Dan Moulthrop of WCPN Idea Stream. We will return to our speakers in a minute for the traditional City Club questions. We encourage you to formulate questions for our speakers now and remind you that your questions should be brief and to the point. We welcome all of you here and those listening to WCPN 90.3 FM. WCLV, WTAM, and one of our many radio stations across the country. Radio broadcasts of the City Club are made possible through the generous support of Case Western Reserve University. Our television broadcast partners are WVIZ, PBS Idea Stream, and Time Warner Cable. Television broadcasts are supported by National City, now a part of PNC, and Cleveland State University. Closed captioning is supported by Nordstrom Corporation. Our webcasts are supported by the University of Akron. Today's forum is the Herbert and Nettie Borstein Endowed Forum, which recognizes a generous gift by the Borstein family. Endowed forums are one of the many ways we keep the City Club strong and vital. If you share the Borstein's commitment to civic engagement, please consider learning more about how you might endow a City Club program. Also today, we are pleased to welcome guests at tables hosted by Baker Hostetler and Medical Mutual. Thank you for your support. Now we would like to return to our speakers for our traditional City Club question and answer period. We welcome questions from everyone, including guests. Holding the microphone today is Assistant Director of Development Marcella Brown and Education and Outreach Coordinator Deborah Agasti. Now, first question, please.
Gentlemen, I appreciate your taking on a very tough issue here. I want to give some personal experience that leads to my question. For 40 years, I was a subscriber to the Kaiser Permanente health plan here in Cleveland, which I very much appreciated for two specific reasons. One is it aimed to keep me and my family healthy, and number two is I almost never got a piece of paper that was a bill from them because the system was integrated in a way that I didn't have to deal with anything but pay insurance premiums or maybe small copay. When I had to leave that plan because my insurer or my employer dropped it as an insurance option and had to go to a more traditional insurance plan, I found two significant problems. One is in finding new providers, they were used to dealing with people that were ill, not healthy. So when I had an appointment with a general practitioner recently for a minor problem, she even said, "It's nice to see somebody healthy for once." That's a very poor comment on how our system works, obviously. Secondly, I now get 3 different insurance plans sending me, for providers, Medicare for my wife, a supplemental policy for her, and another one. On almost every medical activity we have, I get 3 different providers sending me paper about what is owed on the procedure. Obviously very wasteful. Is this reform changing the system in a way to emphasize healthiness in all aspects, not just in screenings, and particularly public healthiness, exercise, losing weight, not smoking, et cetera, all the things we know will save money? And 2, is it doing anything to change the integration of the billing practices so we could get to a system that would be easier for me as a consumer and the companies to deal with?
Thank you very much for that question. Congressman Ryan?
Well, yes and yes. There's a number. Right now we spend about 4 cents of every healthcare dollar on prevention, and we're trying to get a lot more of the healthcare spending put up front. We eliminate copays for prevention in Medicare. We don't want any copays in the basic health plan that we're going to put together. So basically we're going to put a group of people together, the Surgeon General, docs, and other people who have an interest, to set a basic plan that every insurance company who gets into what we're calling the exchange will have to, at the bare minimum, have this basic plan. And we have a group of experts that are now analyzing and will continue to analyze best practices in wellness, and therefore determine what preventative measures, wellness, those kinds of things will be covered in the different plans and in the basic plan. I also think, and I'm not sure if it's in here clear enough yet, but I also think patients should be rewarded too as well. We said earlier about paying doctors for increased performance and increased health of the patient, but I think the patient should also be rewarded. If you're exercising, if you're putting the time in to take care of yourself, as you obviously have, that you should be rewarded in some way with discounts and credits, or I don't know exactly how it should work, but there should be some incentive for that as well. And I know there's a consistent review of practices within administering, and because there is so much duplication, and especially now if you do have a public option and you have Medicare and you have all these different things going on. So I know there's I don't know if it's a panel. I get scared to say even panel, even if I don't put death before it anymore.
Commission?
We have a commission we're putting together that will analyze basically the process of administering the health care plan and do our best to continue to streamline it.
Okay. Congressman Boccieri, you want to add
Just
to
a
that?
quick comment. You're one of the lucky ones, sir. I mean, 11% of Ohioans are uninsured right now, and 64% of those 11% uninsured have one person who's working in the family. And that is a significant statistic in my opinion. Prevention has to be a part of this discussion. We have to have, no pun intended, skin in the game. And we've got to make certain that we're doing all that we can to promote health, wellness, nutrition, diet, exercise, those things that are very integral in making a well-rounded patient. And this fee-for-service system that we have right now needs to be reformed and modified, in my opinion.
Thank you very much.